So I'm Greg Gelburd. I'm a family physician in Charlottesville. My practice is off the downtown mall, not far from here. And for the last 14 years, I've been seeing a population that's mixed, those who are insured and those who are uninsured. About 10-15% of my practice is made up of people who are uninsured, and so we have a sliding fee scale. The sliding fee scale is $10 to $20 per visit. That's their copay, and we kind of eat the rest. About 10% of our practice is Medicaid, another 10% is Medicare. So what I have found over the last few years is that there's still a lot of people who fall between the cracks. These are folks who are working. These are folks who are either starting their own job or they're piecing together several part-time jobs, none of which pay health insurance, and so these people are having to pay their way. And that's how they wind up in my office. So the benefit of an office like myself is that at least they get some primary care. The problem, though, is that they really don't have access to surgeons and radiology and some of the expensive lab tests that are needed sometimes when people have chronic diseases like hypertension, heart disease, diabetes, things like that. Those folks are still kind of in a problem because they don't have the ability to pay for these expensive tests or procedures if it's surgery. So those people are still waiting for the people in Richmond to pass the laws so they can get Medicaid. So at this point, there's still a deficit. And I'd say that every day I see at least one or two people who fall into that category. The majority, 90%, probably are working or they're in between jobs. They just can't afford health insurance. There are some issues that are improved by the fact that the Affordable Care Act has allowed some of these people to actually have a good policy. I had one patient in last week who pays $35 a month. This is a guy in his 50s. He has a couple chronic diseases, none of which is potentially fatal. He doesn't have cancer. He's actually doing okay because his policy is probably $300 a month, but he only pays $35 a month, and his copay is not much. I think his deductible is about $250 per year. So he's actually doing pretty well because of the ACA. There's just other folks who fall between the cracks completely. There are some folks who make a little bit more than he does, but don't make enough to afford good insurance. They have too high of a deductible, like $10,000, which doesn't do them much good.